Hello, my name is Dr. Daniella DaPonte. I'm a psychologist at the Clinic of Applied Psychology in Moncton, New Brunswick, and I was asked to talk a little bit about mental health. So my goal for today is to provide some general information on what is mental health, what are some signs that your mental health might be declining. We'll talk a bit about the impact of chronic illness on mental health and on caregivers. We'll touch on some coping skills as well as other ways to get help. So, what is mental health? Mental health is an overall state of psychological well being. So, in a similar way to how we might describe physical health as the health of our body, mental health is the health of our mind. Mental health can include our thoughts, emotions, our social abilities, as well as our ability to manage stress. It can include our behaviors, how we act as well. Usually, when our mental health is good, we're better able to cope with life's challenges and stressors. This doesn't mean that we don't experience them or that we don't experience difficult emotions, but we're better able to manage them and to get through the challenges. With good mental health, we might find better satisfaction and meaning in our days. Good mental health can also lead to increased self-esteem, increased ability to evolve in our personal growth. It can lead to increased resiliency. So resiliency is our ability to recover from challenges, to bounce back from challenges. On the other hand, poor mental health could lead to psychological symptoms or even mental illness. So mental illness or mental disorders are changes in our ways of thinking, feelings, behaviors. They include a range of psychological symptoms. Mental disorders do lead to significant distress as well as impaired functioning in different life spheres, so at work, at home. Typically, mental disorders would require treatment such as therapy or medication. So it's important to mention that mental health is not only the absence of mental illness. Someone can not have mental illness but still struggle with their mental health, while the opposite is true too. Someone with mental illness can find ways to develop healthy coping strategies and live a meaningful, balanced life. Mental health is important for everyone. It's important for all stages of life, so from a young child to older adult. And it's also possible that your mental health is affected by different situations and changes over time. So if you are going through a significant stressor, it can have an impact on your thoughts, your emotions. This doesn't mean that you'll develop mental illness. It is possible to get back to a healthy mental state by using some of the tools we'll discuss later or by reaching out for additional help. So when it comes to humans, we are meant to experience a range of emotions. It's normal to have bad days. It's normal to experience difficult emotions. We all encounter stressors. As humans, we're designed to handle stress. However, stress can become problematic if it becomes chronic or if it exceeds our ability to cope. So this could lead to a decline in our mental health. We could start experiencing psychological symptoms in reaction to stress. So I've listed here some examples of common psychological symptoms, so signs to look out for if you're concerned about your mental health. So some symptoms could include changes in appetite, maybe eating more or less than usual. This can have an impact on your weight as well. We might see changes in sleeping, maybe insomnia, sleeping less than usual, or maybe you're spending more time sleeping than usual. There might also be physical symptoms. So this could include rapid heartbeat, sweating, difficulty breathing, tensions. There might be some changes in your usual social tendencies. So maybe wanting to isolate or withdraw from friends or family. We'll often see as well loss of interest or pleasure in usual activities. So maybe the things that usually bring you joy aren't doing that anymore. You might also notice changes in thinking, maybe increased worrying, ruminating about past events, difficulties with concentration, attention. There can be a decreased overall functioning, Maybe you're noticing that your performance at work is not as good as usual, or maybe there's difficulty performing usual household tasks. There can also be a decrease in overall ability to maintain a routine in self-care, in hygiene. The symptoms you notice would have to be different from your usual functioning. So they really represent a change in your functioning. And again, it can be normal to experience some of these at times when you're going through difficult or stressful periods. But if you do notice several of these symptoms, or if you find that they're persisting or they get worse over time, it could be a sign to get further help or that they need to be addressed. Um, so let's talk a little bit now about chronic illness. So one thing that does have a significant, or that can have a significant impact on our mental health, is the stress of living with chronic illness. With chronic illness such as kidney disease, heart disease, diabetes, etc., it does bring many challenges that can lead to difficulty adapting. So, for example, a lot of uncertainty with chronic illness, uncertainty about the future, what that might look like, about upcoming tests, procedures, medication. This can lead to increased worrying. It might lead to fear, anxiety. There's also the aspects of having to adapt to the reality of a chronic illness. This can lead to potential changes and limitations in your usual activities. There can be grief associated to this as well, the grief of the loss of usual functioning or typical activities, maybe in terms of hobbies that you're no longer able to engage in, or changes in your ability to work. There is a need to redefine yourself when it comes to chronic illness, and this can be really difficult. It can be really challenging to have to adapt to this new reality. There's also a range of emotions that are present when we're dealing with chronic illness, whether it's initial shock, maybe anger, sadness, the anxiety, feeling discouraged. There's also the physical symptoms that are associated with the illness, such as not feeling well, pain, maybe side effects of the medication. This can be really difficult to adapt to as well. There's also the stressors, such as impact on different areas of life, family, work, financial stressors. So all things that can certainly have an impact on your mental health. And while some of these challenges are common, normal, or to be expected, if they do persist or worsen, or if you do notice some of the symptoms I mentioned earlier, that can be a sign that maybe further help is needed. You might need additional support to help adapt to the changes and challenges of living with chronic illness, maybe needing to develop some coping tools that we'll talk about later. When it comes to caregivers, chronic illness also can have an impact on their mental health. So this might be a family member that's taking care of a loved one. They will likely experience many of the same stress and worries as their loved ones. They'll have a range of emotions, fear, sadness, grief, anger. They might not feel that they're always able to express these emotions for fear of how it could impact their loved ones. There's also disruptions that come with being caregivers. So changes in ability to work, social activities, the routine can be difficult to adapt to. There could be a sense of lack of control or unpredictability. So not knowing what challenges are coming, what responsibilities will be added. There can also be burnout or exhaustion from caregiving, especially if it does become long-term. That being said, there can also be some positive aspects to caregiving. Some people do find that they get fulfillment from giving back to a loved one. It can lead to increased connections or bonds with their loved ones. They might find satisfaction or a sense of purpose, pride, meaning from helping their loved ones. So definitely some positives there too. But it is important for caregivers to continue to take care of their mental and physical health. It can be easy to neglect our health when we're putting time and energy into our loved ones. So we want to make sure that we're maintaining as much of a balance as possible, not skipping appointments, not skipping meals, maybe setting boundaries if needed, being aware of the signs that we're not doing so well and that we might need further help, and also reaching out and accepting help when needed. It's really good to remember that we do need to take care of ourselves in order to continue caring for our loved ones as well. So, how to maintain good mental health? What I'm going to talk about now is coping skills. So, when we do develop and strengthen our coping skills, they can help maintain our good mental health and also prevent further decline. Coping skills are strategies that we use to help us deal with difficult situations and stressors. This can include internal or external stressors. They can involve conscious actions or behaviors to help us adapt. They can also involve ways of thinking. They can be focused on finding solutions or maybe more focused on managing emotions. Coping skills won't necessarily take the stress away, but they can help reduce it and help us feel that we're better able to tolerate it or manage it. They can help us adapt to life situations a bit better as well. Sometimes we do develop coping skills that are not always helpful. Some examples of these might include avoidance. So maybe avoiding things that we could be doing or avoiding our own emotions or unwanted internal experiences. This can maybe be helpful in the short term, but likely not helpful long term. Consuming drugs or alcohol as a way of coping or managing emotions can be unhelpful as well. So it is important to make sure that we have some healthy coping skills. So I did provide a little list here of some examples of coping skills. Social connections, very important. Humans are meant to be in connections. We can get support from family, loved ones. It can also be beneficial to get support from someone who's maybe going through something similar, maybe a support group. Physical activities here, we do know the benefits of exercise and movement on mental health. In the cases where there might be some physical limitations, we can be creative in how we move our body, find ways to adapt to these limitations. Problem-solving techniques, relaxation techniques such as breathing, visualizations, meditation can be helpful. Mindfulness skills, so working on being present, adopting a non-judgmental and accepting attitude. Some find that humor is a good way to help deal with stress at times. We can also look into managing our daily habits, daily routine, trying to get good, consistent sleep, good quality sleep, maintaining a structure for our sleep when possible. Our eating habits can have an impact. Making sure that we're engaging in hobbies, things that do bring us a bit of joy or a sense of peace. It can be a coping skill to ask for help, to accept help as well when it's offered, setting boundaries when needed, and just maintaining an overall good life balance can be very helpful in managing stressors. So there's some suggestions of places we can start for coping with stressors. If you do feel that your symptoms are increasing, if you feel like your overall mental health is declining, maybe you've tried implementing some of these tools, but they don't seem to be helping, you might need to reach out to a professional. So like I mentioned at the beginning, sometimes mental health challenges and disorders can require treatment by medication or psychotherapy. You can also choose to consult as a way to prevent decline. So even if you're not necessarily at the point of a mental illness or severe psychological symptoms, you can choose to consult as a way to help you strengthen your coping skills. It can also be a good place to process some of the challenges associated with chronic illness or other stressors. You can get support through adapting to these challenges. So if you do choose to get additional help, you can maybe talk to your medical provider, family physician, other medical professional. They might be able to guide you, maybe explore treatment options. They might be able to refer you to a psychologist if that's what you're wanting. If you do want to speak to a psychologist, typically psychologists work in either private or public settings. So private setting might be a private clinic, public would be community mental health centers, hospitals, schools. Each province has a psychological association. For example, here in New Brunswick, it's the College of Psychologists of New Brunswick. Usually when you go on the association's website, they will provide information on finding a psychologist. There's usually a list of psychologists that includes a little description of their areas of practice. You can go on the Canadian Psychological Association website. They do provide a list of all the associations for each province. There's some different resources on that site as well. There's also the Canadian Mental Health Association website. There you can search for the branch nearest to where you're located. There's also some different resources as well as information on helplines in case of crisis. So these would be some good places to start. So I hope that this presentation was helpful for you. I hope that something I said was able to maybe clear up some questions about mental health, maybe encourage you to seek out help or to work on strengthening your coping skills. So thank you for listening.